Go ahead.
All right, well, great. I'm super excited that all these folks can join us tonight. Hey, Molly, I see you're just coming on. A couple months ago, I guess it was back in March, People's Action invited some of us from Rights and Democracy to come together and be part of a national cohort around the opioid crisis. We're in a particularly rough spot here in New Hampshire, so I think it's something that weighs on our minds heavily on the residents of New Hampshire, and what things we might do that will improve the lives of all of us. So we have an assortment of people tonight. We're going to start off the first section of the meeting with Lindsay from the Drug Policy Alliance, and then we have a couple of folks, Dean Lemire and Dan Raymond, that are on the call, that will be talking about harm reduction and the principles around that, and ways that we might look at the crisis from a real, I think of it as a real humanistic view. So, and then we're going to go into a sort of a legislative piece later on, and we'll take questions after each section. So if anybody's confused or wants to clarify something or doesn't, whatever it is, please feel free to jump in, and we'll take questions after a few minutes. So with that said, Isaac, you were going to talk for a couple minutes about about Rights and Democracy and the work that we do. In general, I'll just say that one of the things that I've been with Rights and Democracy for about 6 months now, and a big part of my work has been around doing a listening campaign, where I've talked to over 1,000 people, residents of New Hampshire, about what issues are most important to them. And this was a big one. It's not necessarily the #1 issue, but it is definitely, we'll know probably in the coming weeks where it came out in the mix of things, but it is definitely something that weighs heavily on people's minds here in the Granite State. So I'm hoping we can come up with some really positive things that we could do about it. So without further ado, I'd like to get started with Lindsay LaSalle. She's joining us from California, and the Drug Policy Alliance. Welcome, Lindsay.
Thank you. Thanks for having me. You can hear me all right, okay? Okay.
Yep.
Great. So yes, I'm from the Drug Policy Alliance. We are a national nonprofit organization headquartered in New York, but I'm based in the Bay Area. We are largely focused on rolling back the drug war. So we promote policies that both best reduce the harms of drug use itself, but also of drug prohibition. And we do that largely through legislative policy campaigns as well as communication campaigns. So I'm briefly going to give you a snapshot of the history of the war on drugs to kind of contextualize the moment that we're in right now and what kind of precipitated the current overdose crisis. So the modern day drug war began in the 1970s with President Richard Nixon. The war on drugs is primarily characterized by a set of policies that is focused on enforcement, incarceration, abstinence, and just say no. Those are kind of the tenets of the war on drugs and have been consistent throughout the last 5 decades. These policies were primarily premised on the perception of people who were using drugs as being bad and immoral, and primarily connecting those so-called bad and immoral people to their race and associating it very specifically to communities of color. And so I want to read a quote, which is by John Ehrlichman, who is counsel for Richard Nixon, about really the impetus for the drug war. And this is his quote. "You want to know what this is really about? The Nixon White House had 2 enemies, the anti-war left and Black people. You understand what I'm saying? We knew we couldn't make it illegal to be either against the war or Black, but by getting the public to associate the hippies with marijuana and Blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did. So this is the impetus for the drug war, and those racist origins have really been consistent throughout. Drugs largely became a proxy for people of color and an excuse to lock up Black people, brown people, and poor people. Between 1980 and 1970, incarceration rates for nonviolent drug offenses increased by 800%. And of course, we know that these convictions come with a host of consequences beyond the actual incarceration. So people no longer have the right to vote. They no longer have the right for public housing, for student financial aid. Obviously, they're going to have difficulty getting any employment. So what we're really talking about is the complete disenfranchisement of huge swaths of our population, and particularly communities of color, from effectively participating in our civil society. And again, Black and white people use drugs at relatively similar weights, but the imprisonment of Black people compared to white people, for instance, is about 6 times higher. And nearly half of all prisoners in federal prison are there for drug offenses, and 20% of state prisoners there for drug offenses. This is significantly higher than any other single offense. The way that this is really playing out today is that the result has been the complete divestment in any public health infrastructure that could actually effectively address drug use, because we have pegged all people who use drugs as immoral and as bad, and as in need of treatment, recovery, and abstinence as the only measure of success. Which means that there has been a total failure to embrace harm reduction approaches, which Daniel is going to talk about later, a total failure to provide a social safety net, and a failure to provide effective evidence-based treatment that is not solely based on an abstinence model, like, for instance, AA, which is obviously heavily oriented towards a spiritual framework, heavily oriented to abstinence, and in and of itself is not even actually treatment, but is rather a mutual aid support group. So you have a divestment which could have allowed, in these resources, which could have allowed us to effectively prevent, prepare for, and then respond to the current overdose crisis, because our lens has been so focused on enforcement and punitive model. And what that means for some place like New Hampshire, which is primarily white, right, is that now you have these communities that are suffering from very high rates of addiction and overdose that are caught in these crosshairs because the drug war has been so racialized, and there isn't an effective means to now address it. We are starting to see the rhetoric change because of the changing demographic of who is using, and we see more compassionate rhetoric from elected officials and the embrace of some things like naloxone or Good Samaritan. But fundamentally, we still see that the primary response continues to be to lock people up and really throw away the key. And so, Daniel is going to touch more on the harm reduction approaches that actually are effective, but I think the important thing to note is that the drug war really precipitated the overdose crisis. When people talk about the overdose crisis, they're talking about it's the pharmaceutical companies, it's the oversupply, it's doctors who were acting immorally, and all of those things can be true, while at the same time recognizing that if we actually had an infrastructure in place to address it, this wouldn't have been an issue in the first place, right? And again, reverting back to this kind of supply side, the supply side tactics and not addressing the underlying demand, and why really people were beginning to use opioids, and now with increasing frequency stimulants like cocaine and methamphetamine, and really being able to effectively address those through the harm reduction approaches that Daniel is going to touch
on. Thank you, Lindsay. Wow.
Sure.
Heather, you're unmuted now. Sorry.
That's all right.
Okay.
That's all right. I just wanted to say, if you're just getting on the call, there's a chat function that you can open at the bottom of your screen, and there's some chat going on, and people were asking about the quote that Lindsay just said from the Nixon quote. So that's up in the chat function. So next up we have two people, Dean Lemire from New Hampshire Harm Reduction Coalition, who I've met very briefly, but also want to just give a shout out to the film called The Heroin Effect that I saw in the last year that Dean is in. And it's an excellent film that really nails down some of the issues we're talking about tonight. And then we also have Daniel Raymond, who is the, let me see if I can get this right, Deputy Director.
That's enough, yeah.
That's enough of HRC National, right?
Mm-hmm.
Correct. So I know you guys have talked. I'm going to let you guys take it away then.
Right, and Dean, I think I was going to start and then you were going to jump in? Okay.
That works.
Great. So thanks, everybody. Thanks for having me on this. I grew up in Massachusetts, but my mother's family is from New Hampshire, so I spent a lot of time there growing up, and it's nice to reconnect. Lindsay said I was going to talk about harm reduction. I will tell you a little bit about how I see harm reduction in a moment, but I just wanted to go through a few kind of top-line points first, sort of from a national perspective. I work for the National Harm Reduction Coalition, so I'm based in New York. But we follow these trends and what strategies and solutions are working in different parts of the country. So my first point is that International Overdose Awareness Day, for a lot of us, it's a day of remembrance, a day of mourning, a day of celebrating the lives of people that we've lost. And that's feeling very acute for some of us in the national harm reduction community this week, because last week we lost one of our main heroes, Dan Big from the Chicago Recovery Alliance, who really pioneered and drove a lot of the expansion of the move to get naloxone, the overdose reversal drug, into the hands of people who use drugs so that they could save their loved ones. And so a lot of us will be showing up at events this Friday to remember, to grieve, to recommit. I think that it's important for us to hold some space to name that the overdose crisis, as Lindsay said, is a political crisis. That it didn't just happen, that it's more than just a collection of individual tragedies, that it came out of the nexus of stigma, access to healthcare, mass incarceration, and putting profits over people. We did not have to have an overdose crisis. And the fact that we continue to have one and have not bent that curve is a problem that we need to continue to politicize, that we need to continue to electoralize and demand more. I also want to say, for people in New Hampshire and other places like West Virginia or Kentucky, Ohio, that have been really hard hit by overdose, this feels like it just keeps going on and getting worse and worse. I think it's important to name that there is hope. When we look at the national trends and the national data, neighboring states or nearby states, New England, Massachusetts, Vermont, and Rhode Island, have each started to see declines in their overdose deaths rates, despite facing similar challenges to New Hampshire. And they've done that by expanding things like harm reduction and medication for drug treatment, and addressing issues about people not getting treated if they're getting incarcerated. So there is hope, there are opportunities and options, and that's an important message to send to your local and state politicians in New Hampshire. Why can't we do what they're doing in Vermont? Why can't we do what they're doing in Massachusetts? And that's the other piece, that we can do more, that we've got to keep demanding leadership and resources over rhetoric and press releases. And in particular, we win when we center and elevate the voices of people most at risk and most directly affected. So often the people who are at risk of overdose or experiencing overdose, who are dying of overdose, are left out of the conversations, right? They're treated as people who everybody else has to talk about what to do about, rather than people who are part of the solution and who have their own ideas of what they need to survive. Another point, not every solution is a good solution. And so the downside of calling overdose a crisis is that leaves all this room for people to sweep in and say, I've got the solution, we've just got to do more of this, we've got to do more of my thing. And not every solution is a good solution. We have to reject calls for more law enforcement, for more prosecutions, and for longer sentences. Those are not going to take us in the right direction. But a lot of people are going to be very susceptible to those calls because for some people that makes them feel safe. Even for some people struggling with a family member who, who might say, at least if my kid is locked up, I know where they are at night. We've got to be very sensitive to those dynamics, but push back too. And also reject the shifting of blame and exploiting of overdose to fuel anti-immigration policies. So some of you will probably remember, during 2016 in the run-up to the presidential election, we've got to build a wall with Mexico that will keep the fentanyl from killing people in New Hampshire. That is another fake solution that will push us in the wrong direction and further divide us. So where does that leave harm reduction? Just briefly before I turn it over to Dean, who can talk about harm reduction in practice in New Hampshire, I've been saying that harm reduction shows us how to win. Because when we do harm reduction, we're saying that we're going to shift resources and power to the people most vulnerable to structural violence. That people who are dying of overdose are also dying of overdose due to homelessness, due to repeat exposure and harassment by law enforcement, due to lack of economic opportunity, due to racist drug laws. And so what we do when we shift resources, we say, you've been denied access to sterile syringes, you've been denied access to naloxone, you've been denied access to a place to live. We're going to change the conditions of access to include you. And when we talk about shifting power, we say that we're going to make space to build community and power with people who are currently using drugs, as well as people with experience, people in recovery, allied family members, instead of marginalizing, dehumanizing, or disenfranchising them. So that's what harm reduction looks like in the big picture. I'm going to turn it over to Dean now to talk about what harm reduction looks like today in New Hampshire.
Sure. Thank you. My name is Dean Lemire. I'm a person in recovery, of the service population, for some of the stuff that I've helped to set up that touch people who inject drugs, and a New Hampshire native. And my experience trying to access care for my addiction when I was finally ready to just kind of surrender myself to whatever services were out there. It really didn't matter what. By the time I made that call for help, despite fear of consequences like arrest and stigma, it took 3.5 weeks for me to finally get into a state-funded anything. And what was availed to me was an abstinence-based, boot camp for AA type of place, which was really the model for treatment for addiction in New Hampshire that was state-sponsored, state-funded. And that was just 6 years ago. So, for lots of reasons, my privilege, I didn't have any felonies. I'm a white kid with thick glasses rolling through Lynn, Massachusetts. And, I just didn't get penalized or stopped or harassed as much as I might have been if I looked different. I had a lot going for me, college degree. And so my recovery was rather quick. I had a lot of just personal motivation. I also lived in an area that had a really strong recovery network, mostly, in the 12-step fashion at the time. So I've been able to abstain from drugs and alcohol all this time. However, I noticed, folks to my left and my right in treatment and after treatment were dying. Fentanyl had really hit the scene in New Hampshire around the time that I went into treatment, and a lot of people were dying. So, at first my work was to set up kind of recovery-focused services, because there were very few resources. There's not an infrastructure for chronic care for recovery services in New Hampshire, because we have been treating it as an acute problem with short-term services all this time. So I helped to establish some local recovery housing and later on a recovery community organization in my area that was going to offer folks multiple pathways of recovery. And, Joe Hannon, who's on the call, can attest that that's been a really awesome success, is just offering people different options rather than jails, institutions, and death, which is kind of the framework that I was raised in my recovery. And then I kind of got into a public health world, and started seeing some gaps, along with others, including Joe Hannon. Mostly people in Stratford County were starting to, what more can we do? And we started, I was a point of contact for the state to distribute naloxone in a couple counties when naloxone became legal for lay people in 2015. Some of us petitioned the state to allow us to do a peer distribution model rather than just public events, which was how they distributed naloxone at the time. And that was the state policy, is expecting people to, people who are going to use naloxone to come to public events where there usually are police, and you'd have like 8 people at a time showing up because, the folks at our state level just could not comprehend the actual needs of people who use drugs and are at risk of overdose. So we started this peer distribution model as a pilot, and it was gangbusters. We were able to reach a lot of people and save a lot of lives. And the pilot kind of went away, and now we're distributing naloxone through recovery community organizations and the 2 syringe services programs that are operating in New Hampshire. So small group of us, heartened by that experience. Also, Joe Hannon really championed enabling syringe access legislation in 2016. It took until July 2017 to get a version of a bill that eventually passed. And really, that was the birth of the New Hampshire Harm Reduction Coalition. Our charge has really been to help develop and expand syringe services programs, primarily to reduce the incidence of HIV, HCV. We're prone for an HIV outbreak. We had a small one a month and a half ago, I think, in Manchester, just kind of waiting for that to happen. But also certain services programs are great for delivering naloxone, where the syringe is kind of the engagement tool, and then you get, give the naloxone. So the New Hampshire Harm Reduction Coalition, still a small group of folks looking to expand. We provide trainings to service organizations, to community organizations around, just harm reduction 101, SSP, certain service program 101, and then training and TA around how to develop certain services programs. So, we haven't had a huge role in advocacy as an organization, although our members are incredibly active in helping to change our policies in our state concerning people who use drugs. So we're looking for people who can help to train, who can get into the advocacy space on our behalf, for sure. Really our there is not our entire system of care in New Hampshire has up till now been the opposite of a harm reduction model. Like Lindsay and Daniel were talking about, when you require abstinence in order to engage in helpful services, you lose most of the population that really need your help. And that makes people more at risk for overdose in New Hampshire. When you increase penalties for using or even selling these deadly drugs, you actually increase the likelihood of death increase the toxicity of the drugs that are being sold in the black market. And it is a real project. It's a worthy project to educate our legislators, our neighbors on these very basic facts. And so we would like a lot of help doing that.
Awesome. Thank you, Dean. Thank you, Daniel. And thank you, Lindsay. This is great. Although I realized after we got started that I skipped right over Isaac. So Isaac, hey, we talk about what's RAD all the time, and RAD is actually an acronym for Rights and Democracy. So if you could just give us a quick spiel about what we do at Rights and Democracy and what that looks like, and then we'll take a couple questions if people have them.
Yeah, thank you, Heather, and no worries. I'm just honored to be on this call. Thank you, Lindsay, for that introduction. I think that was a really powerful way to frame the conversation and a really important context of why we're in the situation we're in today. I think, and Daniel, reiterating that this is a political crisis. This was made by overtly racist policy decisions from the early 1970s and are part of a much longer chain of more and more sophisticated ways, I think, of holding down poor communities and communities of color. And so I just thank you both for that introduction. And Dean, it's incredibly inspiring to hear your story and the work that you've done since, and the just incredibly important work that the Harm Reduction Coalition is building and carrying forward. And I'm just very excited to continue that conversation with you all. So Rights and Democracy has been around for just over 2 years in New Hampshire. We're a multi-issue, progressive grassroots nonprofit, and we work on a whole host of issues by organizing people locally, finding directly impacted folks who can build power locally in their communities to change the policies that impact our lives. So bringing people back into the political process so we can truly fight for our human rights and for a future that we can actually live and breathe in. We have currently ongoing campaigns around a number of different issues. We're building up a campaign around defending our public education system. We have worked very hard to defend healthcare rights of folks in New Hampshire as a big part of the Medicaid expansion effort that helped pass that legislation this year. We've been a part of the trans advocacy coalition and helped pass this historic trans rights bill in this legislative session. And we're working very hard to impact the elections this year in New Hampshire because we know that if we're not building intentionally and locally, that we don't have a chance of taking this country back from the right wing, because they have very effectively organized and built up from the local level over the last 40 years, and that's gotten us in the situation that we're in today, where we do not have the power right now that we need to reset our policies and put people and the planet back over short-term profit and greed. But we know that we need to be serious about that, and we need to bring people in together and build power from the local level, because we may not have the money that the right wing has, but we have the people on our side. And so this is all about how do we bring people together, organize effectively, and plug people into the campaigns that we need so we can be building victories on the path towards longer term, really fundamental change, socially, economically, environmentally, in all the ways that our system is currently really destroying the planet and many people's lives, especially those who are already marginalized. So I've been helping build the organization since we started in 2015, and I've newly come to this work in New Hampshire since April, and working with the staff team to build our campaigns, working with our members to build up our leadership around the state, and just very excited to be part of this conversation, because I think that there's so many clear ways in which the unhealthy realities of our culture that commodifies people and commodifies every aspect of our daily lives ties into a culture that is not community oriented, that is disinvesting in health and well-being of communities that are already struggling. And so many of these things tie together with the overdose crisis that we see now. So I know that I have a lot to learn, and I'm just excited to be a part of this conversation, to speak with and learn from you all, and to connect our members with the really amazing and important work that's already happening in the recovery community, so that we can figure out how Rights and Democracy can work to help us build even more powerful campaigns and get New Hampshire to go from, where we've historically been as really the opposite of a harm reduction model to being an example for what the country can be. So just thank you again for everyone who's on this call. And I have more questions than, things I have to say. So there's a little bit of space for questions. If anybody has them and wants to chat them in, please do so. But also try to, this is a little risky, but I'll try to unmute people for a minute here in case somebody wants to voice a question. So take me a second. So we wanted to give a little bit of space for questions. And I think especially if people think of other things, please chat them in so we can bring those in as we continue to move forward.
Great. Thanks, Isaac.
Yeah.
Anybody have a pressing question right off the bat? If not, we can move right into the legislative piece. I just want to say thank you. Is that Bonnie trying to speak in?
No.
Oh, okay.
Hi.
But hi, how you doing? I really appreciate y'all putting into context.
All right, I'm just going to mute everyone again because I think we're going to run into the inevitable problems.
Putting into context that there's not one path that works for everyone. That's Dan, I think.
Working on it. I'm getting there. It's a bad idea. I knew it.
So it's Rights and Democracies, the organization.
All right, he's muted. We're good. All right. Sorry.
We are talking. And cannabis isn't part of the conversation.
Oh, no.
No, I'm muted, but not, okay, so now Dan's not muted.
And
Can you get him muted?
Okay, we're good. Sorry.
Great.
Whew.
Awesome, thank you. No, I really appreciate just putting on the table that there's not one path to recovery that works for everyone. And I think that's super important to just have in the forefront of all of our minds is that what works for one person does not work for everyone. And one of the roundtables that I led a couple months ago, this sort of came up in the context of, I think it was Lindsay that had brought up, AA has the spiritual context, and that doesn't work for everybody. That doesn't work for everybody. And it came up in one of our meetings where somebody brought up that a lot of the groups that are trying to help with the crisis are spiritual in nature, and that doesn't work for everyone. So it's really good to remember that it's not a one size fits all thing. So the next section that we're moving on to is about legislative priorities, and this is the first time we've really had a discussion in New Hampshire, like with Rights and Democracy, about some of the things that we might work on together with some of our membership moving forward, and some things that we might change. And so we have three people on our panel for that part of the discussion. We have Joe Hannon, who's a former state rep and has done a lot of work, Dean mentioned, around the syringe exchange program and getting that law passed. We also have newly elected Phil Spagnuolo, who is also working on some other initiatives that he's going to talk about. And then we also have Adam Krugel from People's Action to give us a little national context to the conversation. So, Joe, we're going to start with you, if you don't mind, being number one.
Oh, yeah. Well, thanks for having me. Like Dean said, I put the initial syringe exchange bill in several years ago, and then didn't get reelected, and had two senators put it in for us. Dean and a lot of other people were a huge help in doing that. So can't thank them enough. Dean was actually, if someone, before we even got started with Hand Up Health Services, which is our syringe exchange, if someone wanted to know what the name of our program was, it was basically 1-800-DEAN. He was it. So give him a lot of thanks for doing that and still doing it. I got some advice from Dan Raymond and lots of other people. The harm reduction community is just amazing. In the legislature, I was one of the big things, and when I was first in 15, 16, was obviously the opioid crisis, they kept calling it. And there was a million task forces, panels. So I was put on a joint task force for the House and Senate, and they took on, we basically interviewed everybody, and we heard all the arguments for all the good and bad ideas out there, and made recommendations for legislation. Like Daniel was saying, they're not every idea is a good idea, and there were definitely some bad ideas that got through. Some things that can affect healthcare for people who don't use substances, like some of the prescribing guidelines. They may be well intentioned, but they actually make it harder for doctors and other healthcare providers to provide needed medication. And I think that also creates resentment. We had a local city council person who went on a tirade recently because his wife had to go to the hospital and get medication. And it was difficult to, apparently, for some reason, because of the addicts out there, all those junkies and all that. I mean, the language was horrible. But, the idea out there for people, I mean, obviously the history of the drug war is definitely racist. There was lots of reasons for doing it. But most people out there, especially in New Hampshire, I don't think are aware of that. And they just know that they don't like those people. And that's something that we're really trying to overcome. If someone commits a crime, that doesn't help, but, it's hard to get compassion for people who've, robbed someone's home. I had a friend whose home was robbed, and they went into a drug court program. And the person eventually came around and said, okay, well, maybe we should help this person out. But the person wasn't very successful with the program, unfortunately. And I think that created some more resentment even after the fact, because, this is one disease that people think that, if you don't get it 1, 2, 3 times, like with naloxone, if you get 3 strikes, you're out kind of thinking. We don't do that with any other disease. We don't do that with diabetes or heart problems. Pushing the syringe exchange bill, I had a legislator look at me, and he had a large nose, and he says, I look all the way down my big nose at those people who do drugs. And I just, I looked at him, and I didn't even know what to say. But I knew that he had a heart surgery recently, and I said, he had a quintuple bypass or something like that. Do you still smoke? He's like, well, yeah. And then he kind of had a little smile. People don't have that connection that they're drawing to their own lives. They think that, drugs are different because it's a choice and all that stuff. But really, if we don't treat it like a health problem and treat them medically like we do any other condition, it's going to be a problem. One of the things we always talk about in the recovery community organizations, and I work with, I'm on the advisory board for SOS. Dean was also a big part of helping get that started. And, we don't just have the 12-step model of abstinence. I got into recovery in 1991, and that was, several years into the Just Say No campaign. And obviously it didn't work for me. We have to be able to have different things for different people. One size doesn't fit all. And to have a legislation or state policy that says this is what you have to do, that's the wrong way to go. So we have to have policies that are flexible. We have to have policies that are tolerant and forgiving, and also don't criminalize these people for just the condition that they have. It's something that trying to think the best way to say it. We basically it's something that it's happening over time. We're changing people's minds, but it's still not completely there yet. Even with naloxone, I was part of the original Narcan bill that we had, and we still see the same comments. We're enabling. We're making it easier for them to do drugs. And I talked to a police officer the other day who was generally receptive to what I was talking to him about. But he said, "Oh, I heard of there's Narcan parties where people will use together so they don't die." And I'm thinking, okay, did you just hear what you said? They're using together so they don't die. That's not a party. That's like swimming with a buddy. It's the buddy system, and we try to encourage that with harm reduction. Harm reduction is not something that just can be focused on substance use. It can be anything. Wearing a helmet on a motorcycle, eating less bacon, whatever. And we have to really talk about those things to people to make them understand that it's not just, the drug issue. And medical and healthcare providers really need to be educated as well. I think we have to have doctors and nurses be able to meet people where they are and not judge them. You know, if someone comes in because they're overweight, you just can't say, hey, you're overweight, you have to lose weight. They're not going to listen. You have to talk to them and see where they're willing to engage. And we have to do the same thing with substance use. Some of the policies, like with syringe exchange, one problem we had was there was a last-minute rider put on the bill that prohibited syringe exchanges from operating within a drug-free school zone. So one of the first program that was up and running officially had to close because they were technically told that they were in that zone. They put a bill in last year to change that, so now they can go ask the local school board for permission. And if the school board approves it, they're allowed to operate within that school zone. But I criticized it. I said, I don't know any school board who's going to approve this. And we have to change that part of it so that we can meet people everywhere. The other part is, you know, a lot of the healthcare that's delivered is in obviously not where people are. If we're meeting people on the street or at a soup kitchen, giving out syringes in a parking lot somewhere, that's where we're seeing people. People need to be able to be seen, maybe more mobile vans or having doctors and people that are providing come to them. So they're just a few areas that I can think of offhand. Another big one is the 911 immunity bill for naloxone. You know, there's some people were against it because they thought it gave complete immunity to anyone who reported an overdose, but it only affected people with possession amounts. It didn't affect people with larger amounts of, you know, dealing, quote unquote, dealing amounts. It doesn't affect people with warrants. So if someone has a warrant, they can still get arrested. So people are still not calling and helping in a timely fashion because we have these things in place. You know, that's something that I think is going to be hard to overcome, but I think it's something we have to try to do to make it easier for more people to not die.
Thank you, Joe. That's some great info. I'd also just like to put out there, Joe's and Dean have been working on the syringe exchange program. There's not a lot happening out here in the western part of the state, so I think it would be great if there's anybody in that part of the state that is interested in expanding that program. I think that would be amazing. Dean is raising his hand. Isaac, can you unmute Dean?
A phone call with folks in the Keene area. They're program director at the Keene Serenity Center. Their peer recovery support services, half the building. They are working on finding people who are going to deliver the services, find a host agency. So we're having a first call next Friday, and I'm just waiting on confirmation of the time. I'm going to put my email in here, so anybody from the western part of the state who wants to talk about developing a certain services program out there, please get in touch with me.
Excellent.
That's it. Thank you.
That's great. So next, Phil Spagnuolo.
Can you guys hear me?
Yeah.
Okay. Hi, I'm Phil Spagnuolo. Thank you guys for doing this. I apologize. I was in my car for most of it, but now I'm at one of my sober houses, and so I'm really. It's been a really good, powerful discussion of the things that we've spoken about so far, and I missed the initial conversation or the initial opening, but I guess I'm up to speed as to where we're at now. What I'd really like to talk about is some possible legislation, especially around, and I think that Joe mentioned this, the criminalization of possession of controlled substances in the state is barbaric. There's no doubt about it. And it's been proven that, by dropping possession down to a misdemeanor, like other states have done, is actually productive and saves the state money. It helps people, most importantly, that, getting a felony on your record, first time, possession charge can be devastating to someone's future. I have a few sober houses, and that's one of the biggest issue that comes up with these guys and trying to get good jobs and those types of things is the fact that they have felonies on their records. Even when they move on from the sober houses, trying to find an apartment, it can be a barrier to just being able to rent in certain situations. And, these are guys that have gone around to turn their lives around and are doing great things and are involved in the community and all of those things. But because they had a simple possession charge 5 years ago, they can't move on in life. So that's one of the things that I plan to address in the next legislative session if I am reelected. Some of the other things that that are happening in the state. We are looking at a large sum of money coming to the state. It seems like the state has rolled out this plan. I'm hoping that in that plan that there's the forethought of we can have all of these places for people to come to ask for help. But how do we provide that help? And Dean talked about this where in New Hampshire we're still, a majority of what we do here is based on the abstinence model and the 12-step model and those types of things. And that there are thousands and thousands of people who don't fit into that category. And I got involved with, so I'm a person in recovery, for those of you that don't know that. I'm coming up on 3 years in recovery. Since that time, I've gone on to help to start a recovery center in Laconia called Navigating Recovery. As Heather mentioned, I am the newest elected representative in the state of New Hampshire in the special election back in February. And through having done the work at Navigating and learning the many pathways model, it has completely changed the way that I've looked at recovery and the things that we do in our sober houses now, as opposed to when I first started the sober houses, has completely changed. And the way that we handle people, we've gone more to where it used to be with sober houses is if you relapsed, you just got kicked to the curb and moved on, and we filled the bed with somebody else. Now we take a different approach. We work with them. We figure out where the problems are. We try to help them, whether it's getting them into some sort of therapy or getting them on MAT. That's another thing that we're doing at our houses that a lot of houses don't do, is we're accepting people on MAT because their recovery is just as valid as anybody else's. And I think that that's something that's been a big barrier. And one of the things that has been huge in my recovery is trying to break the stigma of addiction. The reason that I ran for legislation to become a state legislator was because I wanted to show that people who are in recovery can accomplish anything that they want, and win or lose. I just wanted to show people in recovery that you can do these things and you don't have to be afraid of your past or who you used to be. It's all about who you are now and what you're doing now. And for me, that was a huge personal victory, just being able to do that. So I guess my point is that the way that we approach recovery or have approached recovery in the past needs to be shattered. We need to look at things like needle exchange and harm reduction and whatever it takes to get people into recovery and to have whatever that recovery looks like. But what it has to include is some sort of productive life that gives them fulfillment. Because I know for me, until I had some sense of purpose and felt like I was contributing to my own life, I couldn't stay in recovery. I would fade in and out, over time and all of those things. But once I found this sense of purpose and I had this belief that, I can do anything anybody else does. It wasn't a moral failing. I suffered from an illness. I've worked on this illness, and now I can do anything that anybody else can do. And and that's really the approach that we need to take with people, is to accept them for where they're at, meet them where they're at, and find ways to do that. But my fear is that we've started some of that. Dean and Joe have been instrumental in getting these things started in our state. But we're now at this point where all this money's coming in, and are we going to diverted it all to these programs and these models that we know don't work, that haven't worked. You know, the war on drugs has done nothing but, you know, deplete financial resources that could have gone to combat this way long ago. The strict abstinence 12-step model has worked for some, but what about all the others that were left out in the cold? We've got an overdose crisis that is not getting any better. And we need to get creative and find other ways to reach out to these people and make them feel just as valid as somebody that's in this abstinence model. And I think that's where we've fallen short in this recovery world, is that we treat people differently based on what their recovery looks like. And we need to embrace people in whatever recovery path that they're on and make them feel just as worthy, just as valid as anybody else. And I think that's where we really fall short. So for me, my lofty goals for legislation are to find a way to reduce the criminal aspect to possession and things of that nature that are really a big obstacle to people in recovery. And I'm trying to form a recovery caucus. I've reached out to both sides of the wall, as they say in Concord, and both sides of the aisle, and have gotten some pretty positive responses from people, because I feel like that for this to really, for us to have an impact in this area, we need to get people to the table who are involved in this, and there are people in the Senate and the legislature, and I'm not going to out anybody because that's not my place to do it, that are in recovery that I believe could have a really strong voice in this, and I'm hoping to be able to do that. So
Awesome.
those are the two big things.
Great. Well, I hope we can work together on some of those initiatives. I know we're running a little short on time, but Adam, can you add?
Yeah, I'll be really brief. This is incredibly inspiring. And so, yeah, briefly, my name's Adam Krugel, and I'm the Director of Strategic Initiatives on the national staff at People's Action. Incredibly excited to be with all of you. And I feel like, this is, one of the great, great human tragedies that we're experiencing right now in our country. 72,000 people last year died from this crisis, nearly 200 people a day, every single day. So it's something that, unfortunately, at a federal level, the president and this Congress have not really had any robust response. So the work that you're doing in New Hampshire, and I included a link to just an editorial from last week's New York Times. It really maps out like all the different ways that states are showing how we can save lives. And so that's one of the things we want to recommend. And as Representative Spagnuolo said, like there are states all over the country, there's a growing movement around decriminalizing, really ending. It's critical if we want to end the overdose crisis, we have to end the war on drugs. And so there's places all over the country that are reclassifying felony drug charges to misdemeanors and then reinvesting, capturing all those savings and investing them in harm reduction and treatment. So it's a critical way forward. And so we want to really encourage folks to look at this. And so I also included, Daniel and Lindsay helped us develop a candidate questionnaire. And we can send out a lengthier version of this, but we want to encourage you. Every single person running for office at any level of government should be held accountable about whether or not they're going to help save lives in New Hampshire. There are thousands of people whose lives are at stake, and these are all political choices. So the three things we're encouraging you to consider as you're talking to candidates, and Rights and Democracy is doing amazing organizing all across the state to help really hold officials accountable and build an agenda for healing and justice in the state. But it's like making sure that anyone elected to office, that they're committed to helping to end the overdose crisis and not increase incarceration, because as Phil said, this does not work. It's robbing us of our treasure. It's robbing us of life. Also ensuring that people are expanding the kind of programs that we know already work, like safe space syringe exchanges and different programs. And then third, is looking at expanding, making sure that one of the key ways that states are actually saving lives and reducing overdose deaths is by expanding access to health coverage and making sure that they're not creating all of these difficult, barriers to Medicaid expansion. So those are three things. We can send more of that. Encourage you to really work closely with Rights and Democracy. They're doing amazing work to make sure that we force everyone that's running for public office in the state of New Hampshire to make a choice about whether or not they're going to be at least respond to these questions. And we think that New Hampshire, you have the chance to really change the entire direction that the country's going in. We want to work and support the work you're doing to make sure that whoever the state of New Hampshire nominates to run for president in 2020, that they have to answer to the crisis in New Hampshire, and that they have to look into people's eyes and make sure that they're committed to helping building a culture of life and supporting these kind of progressive policies that we know are going to save lives. So I know we're short on time, so I'll wrap there, but there are people all over the country doing it. We're all looking to New Hampshire, and we're grateful for all the amazing work that folks are doing.
Thanks, Adam. I forgot to unmute myself there for a second. So this is great. I'm really excited to make the connections here with some of the folks on the call and have some folks in New Hampshire know that there are people that are out there that will help them and really work towards some solutions. So I want to I'm going to share another link. If you're on the online part of the call, you can see all the links. I just put up a link for all of the overdose awareness events in New Hampshire that are coming up either the 30th or the 31st. So I'm hoping that people get the word out about all 5 events. The one that is actually happening on Thursday and not Friday, August 30th, is the one in Laconia. And that starts at 5:30 p.m. with music, and then the vigil following that with speakers and some other things going on. There's all 4 of the other ones are happening in, let's see, Farmington Dairy, which is a mom's survivor organization that is hosting that. And then there's one in Keene in Central Square that the Serenity Center is hosting. And we have Ryan Fowler on the call. Ryan, are you there? And you want to maybe say a few words about the Seabrook event and maybe a little bit about your organization?
Yeah, sure. Thanks, Heather. Thanks, everyone. This has been great. I'm Ryan Fowler. I'm also a person in recovery. I used to inject drugs, and now I don't. I work for Granite Pathways. We're a nonprofit serving the entire state with different forms of peer-led models. And so my main location is at a peer-led recovery center called Safe Harbor Recovery Center. And this coming Friday, August 31st, we are having a Night of Hope during Overdose Awareness Day. And so all day at Safe Harbor Recovery Center, we open at 8:30. We're going to be trying to getting people to come in to access our stash of free naloxone. I have both the nasal spray and the IM model for Narcans. We're trying to get folks to come in and get trained real quick and dispense some Narcan to the community. And then that evening at 6 p.m. in Seabrook, we are having a Night of Hope. There's going to be 3 speakers. One of them is myself, and then there's going to be a vigil for everyone that we have lost to substance use. And that event is at the Trinity United Parish House at 29 Main Street in Seabrook. Last year, there was about 100 people. There's definitely going to be more than 100 people on Friday. So if anybody is in the vicinity of the Seacoast, then it's the place to be.
Awesome, Ryan. Excellent. So I shared a couple more links from Granite Pathways and Safe Harbor Recovery Center. I want to respect everybody's time. I know we're a little bit over. Are there any questions out there? Isaac, do you want to unmute folks and see if there are any other questions?
I'm a little scared to unmute everyone, so if you do have a question, please, please post it in the chat function. And we will be sharing this video out, and if there is a question that you want to get to, please post it either as a direct message to Rights and Democracy's Facebook page or on the event itself that we were building for today. And we will.
I'm just going to share my email in the chat. It's heather@radnh.org.
Okay.
So anybody can.
That too, definitely. And I would also just say that, while Rights and Democracy, I think this, in many ways, for us is a way for us to learn from and connect more with the folks in the recovery community and advocates, policymakers, and those who have been in this struggle, and working together to figure out how we can support each other's work and build. I was really glad to hear Adam mentioning like the crucial importance of a healthcare system that's grounded in human need rather than profit. And I think there's no such thing as a panacea, but we have been working hard on protecting the healthcare of those in the Granite State, and our vision is to move toward the offensive as much as we can, and as we build, that will become more and more possible. So I would urge everyone to go to Rights and Democracy's website, radnh.org, and we have a petition that is calling for healthcare as a human right and for a Medicare for all single-payer healthcare system. So if you go to radnh.org/healthcare as a human right, please sign on there. I will post the link in a moment. And I'm just really excited about continuing to build the relationships that we need so that we are connecting the needs and the lived experience of our communities, because those who are closest to the problem are the closest to the solution, to bring that connection together with advocacy at the State House, building power locally, and advancing towards not just putting Band-Aids on the problems and crises facing our communities, but building up towards where we have the power to implement the real changes coming out of the experience of those who are on the ground in this struggle and in many struggles. So I want to thank again everyone who's been on this call, and I'm just incredibly excited about continuing the conversation, to continuing to build with you all, and being part of the victories that we need together over the coming legislative session and over the coming years and decades together. Oh, Heather, you got to unmute yourself. There you go.
Thanks, Isaac. Okay, now you can hear me. And thanks everyone who joined us on this call. I look forward to working with all of you in the future on some of these initiatives. So please feel free to reach out about any of this after the call. It doesn't end here. Anybody else? Any questions? Anything else before we go? I really want to let people go because I know we have another meeting coming up. So.
Yeah. There's that.
Oh yeah, there's that. So thanks everyone. I really appreciate the time.
Have a good night.